what we are seeing is pneumonia, in particular a kind of pneumonia which is called interstitial pneumonia that produce much dyspnea. Dyspnea, it means that you've got a short in breath, you are difficult to breathe while doing everyday activity. This is due because the place where an infection is between where the alveoli and the vascular of the lung, because of the fact that in this situation it's difficult from oxygen to enter in the blood and carbon hydroxide to get outside in air. And so this is why this disease is particularly stressful for the patients, because there's very little oxygen in the blood. Actually, the main age that we are following is adult people. We've got very, very few pediatric cases. Most of the cases are people above the age of 40, and actually the greatest age group is people above the age of 50. In particular, male patients appear to be more at risk rather than female. Whenever we see a patient with interstitial pneumonia that is caused by SARS-CoV-2, this is the name of the virus, it's not that easy to understand who are the patients who will do good or who will do bad, because actually we've got quite limited indication in order to forecast what the clinical evolution of this patient will be. And so this is a part of the difficulty in management of these patients. It's not easy to understand who will the patient who will do worse. And so we need to have constant monitoring of this patient, because apparently we admit patients that seems to be quite stable, but in very few hours they may develop respiratory insufficiency and they need to go into intensive care unit. It is luckily a small proportion, but it really depends on the vulnerability of the patients. And so far, actually, we know that only a minority of these patients. We need to treat this patient well since the very beginning. We are trying to use also antiviral drugs that may have antiviral activities. And so in particular, as soon as the case is confirmed, we are using drugs that we generally have been used in HIV infection, that is protease inhibitors, together with hydroxychloroquine. And as soon as the patient is of course, these drugs are off-label because they are not registered for SARS-CoV-2 infection, but there are clinical trials that are working in order to address its benefit. Please take advantage of what has been the epidemic evolution in our country in order to forecast what presumably may happen in your country. And so first of all, think that the first case has been in a hospital and this patient was not recognized for 4 or 5 days having SARS-CoV-2 because of the fact that contemporary he had a severe bacterial pneumonia. And so first message to say is that most of the time, let me say very frequently, SARS-CoV infection 2 is associated with bacterial pneumonia. In the Italian situation, the case 0 was a person that had contact with China, but he was totally asymptomatic. And so sometimes it's so difficult to identify the case 0. But the case 1 should not be missed, because he will be a patient who is admitted in the hospital with severe pneumonia. And so please, in this situation, test as much as you can. With regard to death rate, we are still in a situation in which the death rate is approximately 2%. And so it's not huge. But the burden of this disease with regard of the way in which has changed the lives of people is already very huge, and the burden of economic consequence is really huge. And so again, of course, we need to avoid the death, but we also need to avoid infection because the impact is really big.